Oban, Scotland's first healthy living town, supporting each other to live healthy, active lives, creating health in our communities.
Hi, I'm Roy Clooney. I'm a volunteer director with Healthy Options.
My name's Derek Laidler. I'm the professional lead physiotherapist for Argyll and Bute.
It's really about launching Oban as Scotland's first healthy living town, and it's in response to the recognition that we all need to be more responsible for our own health and our community's health. 1 in 6 deaths are caused directly through being inactive. As a society, we're walking less, we're taking exercise less and less, and 40% of the adult population are now classified as being inactive, so they're not taking enough exercise to stay healthy. But we also recognise that we've got everything we need here for people to be healthy. We live in a wonderful place, a fantastic environment. We've got facilities. We already own a sports centre. We own a cinema. We've got the Rockfield Centre coming on. So we've got everything that we need. We just need to harness that. We need to mobilise all our organisations, and we want to enthuse people and encourage them and support them to be healthy. What we're really doing is we're creating health in our community now. Rather than just helping people who are a bit poorly or have got conditions already, we actually want to create health so that people don't develop serious conditions.
We've traditionally had a very reactive NHS responding to people when they've become ill, and that's no longer sustainable. So things have to change, and we have to help people to take more responsibility for their own health and well-being, so we're not becoming unwell or unhealthy in quite as high numbers as we are at the moment. And you can't just expect people to suddenly up and change the habits of a lifetime. So for me, the Healthy Living Town is about providing a network of opportunities for people to improve their own health and well-being, whether that's physical health, whether that's mental health, because we've got to remember that things like social isolation and the detrimental effect they can have on mental and physical health are quite significant. So even things like lunch clubs, walking groups are just as important as those things like Lorne and Oban Healthy Options, who are providing those exercise opportunities.
There's lots of really good third sector organisations over the last few years have been really working collaboratively with the NHS and the statutory bodies, and there's some fantastic stuff going on, like the North Argyll Carer Centre, there's Healthy Options, there's the Dove Centres, there's the Alzheimer's and dementia, there's Macmillan, but actually we need to do more and help people to be healthy, people to stay healthy and to remain healthy and to be active.
So I would like to see that equity of service, so that third sector, the voluntary groups and the statutory bodies like the NHS are all considered equal partners in helping people to improve their health and well-being.
I am so impressed with the kind of communication and coordination that there is between the health professionals and the voluntary sector, and as you know, somebody who's promoting park run for walkers, joggers and runners as well, I think that to have the communication and be sort of rubber stamped by the GPs and by the hospital and the physio, it's great.
I think it's absolutely wonderful. I think it fits in very much with Alzheimer's Scotland's idea of having dementia-friendly communities and dementia-friendly towns. We need to keep healthy rather than be expecting health boards and councils to provide services to fix us when we're broken.
There is the desire within Oban to make a change. We have a huge amount going on in Oban, and what we need to do is link it together so that the community of Oban knows exactly how and where they can go to improve their health.
Join us as we support each other to live healthily, happily and actively at all ages. Join us as we support each other to live healthily, happily and actively at all ages.